And I kind of want to dig a little bit more into how did you develop that skill set around like managing business relationships, and yeah, tell us more about that. Or what does that
Yeah.
look like for you?
So again, not to be reductionist, but I think that about 90% of the time you can separate your stakeholders into three levels. You have your clinical stakeholders, you have your operational stakeholders, and then you have your executive stakeholders. Your executive stakeholders are the ones who have signed the contract that says, we're spending money on this product, on this service for this outcome. You have your clinical stakeholders who are saying, these are the patients that I need to take care of. Here are the services I'm going to provide to them. And then you have your operational stakeholders who say, I'm responsible for making sure that this project is running appropriately. Everything that a vendor, let's say like MyndYou, is is performing, I'm responsible for making sure they get the patient list, making sure that patient information is accurate. So it goes down to understanding, it comes down to understanding their needs. Executives typically will want just high level overview of where they're going, how is it impacting the bottom line. Clinicians want to know, how is the patient experience, how are patient outcomes being impacted. And operational, they want to know, are you making me a rock star in my organization? The executive above me signed, and I need to make sure that we're on track to make the progress that will say we're going to purchase this product or this service again. So delivering that value and delivering what is expected on time and at the right frequency, at the right channel is essential.
And one thing that I think is like so important, especially when you're looking to maybe go outside of like traditional public health, is kind of like learning the language of the work, because a lot of what you just shared is very public health based. Is like, okay, we have these different communities, the
Mhm.
executive, the operations people, the clinical people. What are their needs? What are the things that they really need to succeed? And how do we support in getting that need met? And I think this is how we have to continue to think about the skill sets that we have in public health, and how it kind of like translates to different things outside of public health, because that in itself is very important. And just being able to speak to how you can take that skill set and translate it and be successful. And I believe Tally said in our interview that like, if you're in public health and you're looking for a health tech job, look for customer success manager positions, because
Mhm.
you'll be able to kind of take a lot of the skill sets that you've gained in public health and transfer it over. You might have to learn and change the perspective and the lens that you're using a little bit. And even going back to like how you're talking about like designing surveys and these kinds of things, which are also things that you learn as a public health practitioner. So I'm glad that you were lifting up these kinds of things.
I can agree more. Like look at customer success, look at customer experience, look at patient experience. There's a variety of positions in hospitals, healthcare organizations, and private companies and startups that have each of those roles. Even if you want to look, primarily what we're seeing a lot of is an innovation arm in hospitals. So
Mhm.
hospitals and health systems are building out their own venture ventures within the system itself, where you can go in and design programs. All of our public health education is about program and project management. That skill set can apply anywhere if you want to start to infuse healthcare and technology together. And if you already have the knowledge and the expertise to understand a patient population, knowing why they're responding to certain interventions versus why they don't. So, I think a lot of people start to say, I don't know if I could do a lot with a public health degree, but if you just expand that mindset a little bit, there's so much potential of what you can do.
Absolutely.